So welcome everybody, my name is Flavio Gazzani and this video is about the changing composition, the demographic composition of our society and how this impact and how the healthcare sector should manage this continued change in the demographic composition. What we mean? So talking about the Western countries such as the European country or United States, when we're talking about the changing on demographic composition, first of all, we're talking about the longer life expectancy. It means that in the last 30-40 years, the life of women and men continue to grow in terms of the year of the life expectancy. Another problem is correlated to the fewer births, so there are less and less new childs that born in European and Western country. So you can imagine when we're talking about the reduction of the births in terms of the births per years and the increase in age, you can imagine how the aging population affect the entire healthcare sector. Why they affect the entire sector? Because the healthcare sector had to be prepared not just to treat the younger or the middle-aged population, but they also had to increase their services, their medical budget for the aged people. Because the aged people, of course, need completely different services, completely different medical examination and treatment. So you can imagine how, for example, the people much older than 65 years, how the cardiovascular and the cardiovascular disease affect this sort of people more than the medium and the median average life. If we compare, for example, to the last 30 or 40 years ago. So the healthcare sector had to be prepared to this increasing percentage of aging people. They had also to be prepared to the fact that, of course, the household, the number of the household is continue to reduce it. And all these aged people right now, but also in the very near future, will need more attention in terms of services provided, because you can imagine now, for example, in the European country, we have 1 of every 6 person that are over 65 years old. And by 2050, it's forecast that this share will be the double. So, and also the forecast of the life expectancy now, for example, in European countries completely changed. So if we forecast by 2070, there is a lot of study that forecast the life expectancy for the men that will reach the 86 years compared to the 78.7 on the present, and the women will reach the 90 years old, 0.2, compared to the 83.2. So you can imagine how this affect completely the demand of the services to the healthcare sector, to the medical practice, and all to the services, because the services for these whole people, of course, should be prepared in terms of providing different not just medical examination, but also different approach to the aged people. So when we're talking about changing the demographic composition and the impact onto the healthcare sector, generally we're talking about if we are focused on the Western country in 3 most important dimensions. First, the aging people. Second, the fact that there is the continued reduction in terms of percentage of births, and also the longer life expectancy. If we are inside the European country, we have also to manage another different variables that affect the healthcare sector. Is the fact that there is continuing increase in migration. When we're talking about the migration impact that, because the migration, especially when the people remain for more than 1 year, it means that these people in some way start to be part of the European society. And of course, also the healthcare sector should be prepared to treat people that come from a completely different racial and religious background. So imagine all the people that come from the North Africa. They had to treat different sort of disease, such as virus that can carry on and so on. And also we have to consider that this demographic change doesn't affect only the people that already live and the resident, for example, into the European country, but we have to manage the continuous increasing amount of people that, for example, escape from the war, from disease, from hunger. So there are several ways how the people migrate, for example, into the European country. Of course, when they stay a few months, this doesn't represent a problem for the healthcare sector, because they will be treated into some specific department or in different settlement. Anyway, when these people start to living in our country, this continue to change the demographic composition. This is exactly what's happened in the United States. In the United States, when we're talking about the changing of composition and the impact into the healthcare sector, we absolutely have to consider the fact that there is an increasing amount of the Hispanic people that come from the South America that continue to move, not just as migrants, but just they move into living in the United States. And this, of course, create an impact into the healthcare sector. Because, for example, the migrants represent people that is younger than the population where the people already live in the United States, for example, such as the European country, because they have almost exactly the same life expectancy. In Europe is higher. Anyway, we have to consider this fact in terms of the services that the healthcare should provide. We have also to manage the way how the aged people, of course, not just need to treat, for example, the cerebrovascular disease or dementia that is typical of the old people, but we have to also consider the fact that because the number of households continue to reduce, because there are fewer births, these old people will remain alone. In this term, the healthcare sector also had to be prepared and to be managed, these people that will remain alone. So these people need completely different services, accuracy, and also the cost. The cost in terms of transport these people, because most of them, for example, they don't drive anymore, or they have some articulation problems, so they need a completely different services. And it's important to understand this contributory change in the demographic composition, because we are already, for example, in most of the European countries, in delay in terms of providing any sort of services to the old people. You can imagine, you already heard many times, that we have longer waiting lists for the old people. And we have also less people that are prepared to treat these aged people. So we have to focus, first of all, if we would like to manage in the near future this continued change into demographic, we have to figure out how is the trend in some specific country in terms of the life expectancy, the reduction of the births, but also we have to figure out how the migration affect the entire society. There is also another important aspect that, for example, because the cost of the life in European countries continue to grow and the inflation continue to affect the low-income households, Before, until 30-40 years ago, the young people generally take care to the old people, but this sort of family caring that was present before is completely disappeared, because now also the young people start to work at an early age. And this represents in some way a gap in terms of providing healthcare services to these old people. So every country have their own different situation, of course. If we're talking about developing country, the situation is completely different, because there is, for example, the boom in terms of births. There are different countries such as China where the government in some way try to control the percentage of births in terms of having 1 or 2 kids for households and so on. But of course, if we focus on Western countries, we have to remember that the aging people, the continued migration, so the continued different racial and ethnic composition of our society should be managed from healthcare services in terms of providing different services, especially for the aged people, but also be prepared for any sort of virus, spreading viruses or disease, because how we see the continual changing and the continual movement of millions of people every year from one country to another, caused by any sort of problem. This also represents in some way a transport or carry on of different disease or viruses. And the pandemic of the COVID-19 represent one of maybe the most clear example to understand how the healthcare sector should be prepared to manage also this event that is amplified by the fact that the migration and also the composition, the demographic composition, are completely changing every year in a different continent, in a different country. Thank you very much.